Scenario 1. Advanced stage lung cancer. A 60-year-old former smoker presents with advanced stage non-small cell lung cancer. Imaging shows a large, unresectable tumor. Which of the following treatment options is most appropriate? A. Surgery. B. Radiation therapy. C. Combination chemotherapy. D. Targeted therapy. E. Palliative care. Answer: E. Palliative care. Explanation: in advanced stage lung cancer that is unresectable, the primary goal of treatment is palliative care to alleviate symptoms and improve the patient's quality of life. Scenario 2. Hereditary breast cancer. A 40-year-old woman with a family history of breast cancer tests positive for BRCA1 mutation. What is the most appropriate risk reduction strategy? A. Mammography every 2 years. B. Prophylactic mastectomy. C. Hormone replacement therapy. D. Annual breast MRI. E. Chemoprevention with tamoxifen. Answer: B. Prophylactic mastectomy. Explanation: prophylactic mastectomy is the most effective risk reduction strategy for BRCA1 positive individuals, significantly reducing the risk of breast cancer. Scenario 3. Metastatic prostate cancer. A 68-year-old man with metastatic prostate cancer progressing on hormonal therapy. Which of the following is the next line treatment option? A. Watchful waiting. B. Chemotherapy with docetaxel. C. Radical prostatectomy. D. Radiation therapy. E. Androgen receptor targeted therapy. Answer: E. Androgen receptor targeted therapy. Explanation: in metastatic prostate cancer resistant to hormonal therapy, the next line treatment includes androgen receptor targeted therapies like enzalutamide or abiraterone acetate. Scenario 4. Pediatric leukemia. A 6-year-old child presents with pallor, fever, and petechia. Complete blood count shows anemia, thrombocytopenia, and leukocytosis with blast cells. What is the most likely diagnosis? A. Acute lymphoblastic leukemia, ALL. B. Acute myeloid leukemia, AML. C. Chronic myeloid leukemia, CML. D. Hodgkin lymphoma. E. Multiple myeloma. Answer: A. Acute lymphoblastic leukemia, ALL. Explanation: the clinical presentation and blood count findings are consistent with all in pediatric patients. Scenario 5. Ovarian cancer diagnosis. A postmenopausal woman presents with abdominal discomfort and an ovarian mass on ultrasound. CA-125 levels are elevated. What is the next step in diagnosis? A. Ovarian cystectomy. B. Ovarian cancer staging surgery. C. CT guided biopsy. D. Fine needle aspiration. E. Observation. Answer: B. Ovarian cancer staging surgery. Explanation: in postmenopausal women with an ovarian mass and elevated CA-125, the next step is surgical staging to determine the extent of disease and confirm the diagnosis. Scenario 6. Hodgkin lymphoma staging. A 30-year-old patient with Hodgkin lymphoma presents with painless lymphadenopathy. Biopsy confirms nodular sclerosis subtype. What is the most appropriate staging system for Hodgkin lymphoma? A. Ann Arbor staging. B. Lugano staging. C. Breslow staging. D. TNM staging. E. Dury-Salmon staging. Answer: A. Ann Arbor staging. Explanation: the Ann Arbor staging system is commonly used for Hodgkin lymphoma, classifying it into 4 stages based on the extent of disease and presence of B symptoms. Scenario 7. Colorectal cancer in young adult. A 35-year-old otherwise healthy individual presents with rectal bleeding and is diagnosed with colorectal cancer. What is an unusual feature of colorectal cancer in this age group? A. Increased risk with family history. B. Predominantly adenocarcinoma histology. C. Typically diagnosed at an advanced stage. D. Genetic predisposition syndromes. E. Good response to chemotherapy. Answer: C. Typically diagnosed at an advanced stage. Explanation: colorectal cancer in young adults is often diagnosed at an advanced stage compared to older individuals, which makes it an unusual feature. Scenario 8. Immunotherapy complications. A patient with melanoma undergoing immunotherapy develops severe diarrhea, colitis, and rash. What is the most appropriate management strategy? A. Continue immunotherapy at the same dose. B. Discontinue immunotherapy and initiate steroids. C. Refer for surgical evaluation. D. Increase the immunotherapy dose. E. Initiate antifungal treatment. Answer B. Discontinue immunotherapy and initiate steroids. Explanation: severe immune-related adverse events, IRAEs, like colitis and rash in the context of immunotherapy should prompt discontinuation of treatment and initiation of steroids. Scenario 9. Neuroendocrine tumor. A 45-year-old patient presents with episodes of flushing, diarrhea, and abdominal pain. Imaging reveals a pancreatic neuroendocrine tumor. What is the most appropriate tumor grading system for neuroendocrine tumors? A. WHO grading system. B. Gleason grading system. C. Clark's level of invasion. D. TNM staging. E. Duke staging system. Answer A. WHO grading system. Explanation: neuroendocrine tumors are graded using the World Health Organization (WHO) grading system, which assesses the tumor's differentiation and meiotic rate. Scenario 10. Cancer survivorship. A 40-year-old cancer survivor seeks guidance on long-term follow-up and monitoring for cancer recurrence. What is a key component of a survivorship care plan? A. Annual cancer screenings. B. Daily aspirin use. C. Monthly laboratory tests. D. Annual prostate-specific antigen (PSA) testing. E. Counseling for depression. Answer A. Annual cancer screenings. Explanation: survivorship care plans typically include recommendations for annual cancer screenings to monitor for recurrence and manage long-term health.